I'm joined today by Chuck Weber, the CIO of Blue Cross of Idaho, and Brian Fortson, the Director of Customer Experience at Blue Cross of Idaho. So thank you guys both for joining me today. Really excited for this conversation. I'm going to start with a question for Chuck. So Chuck, can you tell us a little bit about Blue Cross of Idaho's sort of status as a not-for-profit organization and kind of what that means for an insurance company here in Idaho?
First of all, Chris, thanks for having us on to talk about this. Blue Cross of Idaho is a not-for-profit, and I've worked for for-profit companies in this industry. And the great thing about an organization like this is we're not beholden to Wall Street, right? So our focus can be really about our members and about the community that we serve. And you'll see that, and it's one of the reasons I joined Blue Cross of Idaho is because of that focus to the state and to the membership that's associated with it. And we're not beholden to some large entity looking for making sure that we have quarterly profits, right? We can make good decisions based on our benefits to make sure that we are very stable in our organization, that we can continue to improve our benefits to our members and also our services.
Very cool, thank you. So with that as kind of a backdrop, can you talk a little bit about what the vision for Blue Cross of Idaho is from a technology perspective?
Yeah, so as we're moving forward, and especially in this time with the pandemic and such, it's really come to the forefront that we need to be able to do things better from a virtual perspective, from a digital perspective, and so we're looking to move our systems and our processes, and it's not just technology; it's having about the right process as well, to more real time and being more data focused and using, artificial intelligence and machine learning to give us insights into what's going on with our membership, who's likely to become unhealthy, what can we do to get in front of those things using research techniques and data techniques that have been used in other industries, and especially in focusing our efforts along with providers and giving them information to make sure that we've got a very good focus on the member and the member experience from a healthcare side of things. There's a lot of technologies out there that are focused on AI or machine language. It's great to have those things going, but if you can't act on them, having insights without being able to act on them doesn't make it work. So, along with our clinical staff and our operations staff and Brian Fortson, who you'll talk to in just a moment, we're really focused on the individual member experience, not as a global group.
Very cool. Thank you for sharing that. So, a lot of people watching this, may not be intimately familiar with the operations of a health insurance carrier, but they probably do know that our healthcare ecosystem here in the U.S. is complex and in some ways maybe can be hostile to innovation. What in your mind are the challenges facing a highly regulated industry like this one?
Yeah, it's besides the regulations, right, which are definitely there. If you take a look at the history of medical devices and things, it usually takes somewhere between 17 to 20 years from the time that they're kind of hit the market till they're heavily used. So it's not an industry that has been moving very quickly and innovatively. Yet there are people on the outskirts of things, i.e. Apple, which is not a healthcare company, that is pushing those and breaking down some of those barriers with this stuff. Just on your wrist now, the latest one came out. Now you can do your pulse ox on this. These devices have been around for quite a while, but they haven't been widely used outside of a clinical setting. And so as we're moving towards more real-time capabilities and having information in providers' hands, it's breaking down some of those traditional barriers that they're not used to practicing medicine in this manner, or we're not as an insurer having things, we do everything in batch. That's been the tradition in our industry. So having more real-time capabilities. So it's a mindset change. And that's really what I believe the consumer is going to want in the long term. Now, at the same time, one of the big things we have to be very, very careful of is the security of this data and this information. So just a few weeks ago, these devices are great, and there's a lot of things we can do with them. But just a few weeks ago, there was a person that died due to ransomware in a hospital. This was in Germany. A German hospital got hit with ransomware. And because of that, the device that she was on wasn't able to operate, and this woman passed away. And so as we're moving towards using more data and making it more available outside and using new systems and new technologies, we have to make sure that stuff is really secure, because yes, it's terrible if somebody gets hacked from a financial standpoint. Very painful. You can usually get your money back, but it can take years. There's lots of problems. We're dealing with potentially things that are life and death, truly are life and death. And so we have to be very careful about what we're doing. And so that way, sometimes it does seem a little bit slow moving, but we have to make sure that those things are in place.
Thanks for those insights. So focusing now on, Blue Cross of Idaho's sort of recent modernization effort, can you talk, maybe a little more specifically about the mission and the objectives of Blue Cross of Idaho set forth just a few years ago?
Yeah, so one of the things we try to do from a tech standpoint is reduce our tech stack overall, right? And have more robust systems and working with the best vendors out there. So not having less systems. I know of one large payer in the industry that has almost 10,000 different computer systems that they are operating, right? That's a very complex environment. And so what we were trying to do here is reduce the number of those, try to build better and stronger and more real-time interfaces between those systems so they can talk. So we have less manual processes that we're moving forward with. And as we continue that modernization with best in breed technology systems, that we will be able to move better, faster, and more effectively ongoing. And so we will get from the time frame of moving things from weeks to days to minutes. And that's where we're starting to go. So we've got some exciting things that are going to be coming out in the next few months. Processes that used to take weeks will now be down to, in minutes. And so I'm pretty excited about those types of movement that we've had. And we'll continue to do that and looking at everything we do. And the more we can automate, the faster it can be, the better experience for our membership. Obviously, there's a cost implication to that. We can do things more effectively if we're doing it through a system, and so therefore cheaper. And then that information being a not-for-profit, we can put that money back into benefits instead of sending it right to somebody's pocketbook in another state.
That sounds like a lot of work. I think probably a large portion of our audience is kind of familiar with the effort it takes to complete a digital transformation or to really modernize, a large organization like Blue Cross of Idaho. Can you maybe speak to some of the challenges you've encountered, in the last couple of years, and then on the flip side, maybe touch on some of the wins you've seen?
Mm-hmm. Sure. So some of the challenges that we have, one of the things we talked about earlier is that a lot of the systems in our industry have been primarily focused on batch, right? They didn't have very good APIs. And so working with those systems, having to build hooks into them so we can have a more real time is always a challenge, because if it's not native to that system, then you have to figure out other ways. And there are ways to get around that, but that tends to be a lot of work from that perspective. Second of all is obviously data quality. Anytime you're doing interactions between multiple enterprises, the data standards between them are very different. If you look at healthcare, there are standard ways of transacting, but what goes into those fields and those transactions can be very different. And so converting that and understanding that and making sure that you're very clear on that information, those are some of the challenges that we have. The interoperability rules that are coming out, very excited that we're going to be able to share data between healthcare payers and providers, and it's a big boom from my perspective. But will that data be consistent? Because there is no data standards necessarily between organizations, right? So the quality of that data in any digital transformation is very important to make sure it's actually usable and not just something that's going to sit there and you can't act on that perspective. Some of the wins we've had, we talked a little bit about interoperability. We've been part of the Da Vinci project, which for our industry was really a standardization on the national level, working really with CMS, the Centers for Medicare and Medicaid, to get to a data standardization for some of this interoperability. And with that, we came up with fire standards, FHIR, and we're using those in our new digital app that we've put out. Even though some of the transactions aren't final, don't have to be there for another 9 months. They're supposed to be there at the end of the year, but they're not going to force it until next summer. So we've moved ahead on that, and so that's been a big win. And so we've been in the forefront of that. Our new digital app is great. Our data analytics platform, along with using that with our healthcare economics group, have been able to do some really interesting work with some AI and finding people that potentially are high risk for certain conditions, high risk for certain types of joint problems, and so moving that stuff forward by getting that data cleaned, using it to enhance our processes, and then really be able to act on it has been really important.
Sounds like some really cool stuff, and particularly innovative for a health insurance company. So you mentioned, one of the major initiatives, it sounds like, has been this new mobile app for your members. And maybe I'll ask, Chuck, and then I'll kick it over to Brian here as well. Can you talk to us, a bit about what that project has been like for you, what it has meant for the organization?
Yeah, so this was a completely different technical skill set than we had in-house. So we had to teach some people. We had a really good partner in helping teach our folks some of this technology. It's moved us to the cloud. So we started doing our first, real cloud computing type work. It's gotten us more into DevOps, further down that road. So all of those things have been very beneficial. From a business perspective, it's really opened their eyes to what it takes to be digital, the importance of that data quality in those transactional systems. Is because that's where it gets driven from, right? The app is, there's some work that actually happens there, but for the most part, it's a presentation layer. And so all that data that sits in those back-end systems, that interactivity, and because it is across multiple systems, making sure it can be coalesced back to the end user in a usable and understandable way. You can present a lot of information out there, but if it's not user-friendly and people can't navigate it or make sense of it or work with it, it doesn't work. I think that's what our app has really done. It's getting people access to information much faster. They don't have to call. They can look on their app. They can find providers. There's a lot of really good stuff that's on there, and they can get it from anywhere. And so I'm really excited about that. And Brian Fortson is our director of customer experience, and he's fairly new to the organization. I think he came just before the COVID pandemic, but he's really brought a lot of great insight in what we should do with the app. How do we get that information out? How do we make the user experience much more friendly? And so I'm really looking forward to watching what he's going to get done in the next year.
I came the day of COVID. Our moving truck showed up on the day of shutdown. We weren't sure that they were going to unload the truck.
Wow. So you are pretty new, Brian, to this modernization effort, and it sounds like this is not your typical year to be joining a large coordinated effort like this. What has your your last 8-9 months been like?
Yeah, well, I'll say what a ride. It's been a great experience. I'm coming to Blue Cross of Idaho outside of industry from the tech sector on the East Coast. So this is fairly new to me. I came midstream. I know partnering with these teams heavily on the mobile app to get our app to market. And so one of the things that we've been doing on the mobile app. So Chuck spoke about the data complexity. It's our challenge to make the complex data landscape simple for our users. So we've been taking a human-centered design approach to this app, where we were really looking at market behavior, consumer behavior, our data capabilities, and converging those things together. So we understand, how do people need to use this data on the go, right? So you use a mobile app when you're not at your home. Right. So, one of the challenges that we've been finding is, how do people want to consume their healthcare data while they're outside of their home? So we've put a few transactions in place, and from the feature delivery to the navigation, it's really tailored to what we understand about our users. So that's a human-centered design approach that we've taken. Another thing that we've done is we've paired our business teams, our market and customer facing teams with our delivery teams together, so that we can better understand that data in real time. So, it's very common for organizations to, set requirements and send a delivery team off to develop, an AB or a beta or a prototype, and then bring it back, launch the pilot to market, and see how it goes. We've really tightened that loop where we've put features out. We've segmented our market, so we're going to market in different segments rather than just going big all at once. And we're refining as we see how the app is being used, and we're learning from that. So this project over the last 8 months has been, I would say, a great learning experience, but also a great experience to help drive the development and delivery of this app closer to our members.
Sounds like a sophisticated approach to to really meet the members, meet the patients, where they are, which, like you said, is critical in healthcare these days. So let's just maybe close with a little bit of a plug for the app. If I'm a member, when can I expect to be able to download it and register?
Okay, so great. So like I talked about, we've been delivering the app in phases. So the app is already out to some members. We will realize full scale in the January timeframe. So where we are now is we've launched to a good majority of our commercial groups. Over the coming months, we're going to be, segueing into the government and duals groups. And by early January, it should be available at scale.
That is awesome. Very cool. Well, I think that will do it for us today. Thank you both for joining me. I really appreciate this discussion. And thanks to our audience for listening in. We hope you enjoyed the rest of Boise Startup Week. Thanks all.
Thanks, Chris.
Thanks, Chris.